At no time did I even consider the mechanics of the stroke. This quotation from European Tour professional Paul McGinley, after holding the putt to win the Ryder Cup for Europe, highlights the concept of attentional focus. Although widely studied, the term is poorly defined. However, for current purposes, it will be known as the aspect or object a performer is directed towards. Previous research has separated the construct into two pathways. Internal focus, described as the attention directed towards the biomechanical movement when performing a skill, and external focus, defined by the ability to concentrate on the movement's effect. To further conceptualize the skill, various theories have been used to provide an explanation for the differences between adopting an internal and external focus. A commonly adopted theory is known as the constrained action hypothesis. It states that if skilled individuals adopt an internal focus whilst performing a skill, this will undermine the automatic control processes that would regulate the movement and reduce its fluency. In contrast, if individuals focus externally, it will initiate the use of automatic processes, which in turn will create a more effective movement and outcome. The predictive power of this theory has been validated by studies that have provided evidence that external focus is the most effective form of attentional focus when measuring various aspects of golf, like accuracy, performance, and dual task performance. Although there is an extensive amount of evidence for how to instill a specific focus, which can be seen in the intervention, measuring the use of attentional focus has been shown to be quite difficult. This is due to the problem of validation, as without the use of an fMRI, researchers cannot observe an individual's ability to maintain a specific focus. With it proving problematic, a reliance on the individual's perception using a self-report Likert scale has been found to be the most popular measure to date. A 5-stage intervention was carried out on a 20-year-old golf professional called Bill. Bill approached a sports psychology consultant looking for help to keep his membership on the tour. He had expressed a struggle to stop focusing on the swing mechanics that he and his coach had worked on in the off-season. The aim of the intervention was to combat a focus based on the over-reliance on golfing mechanics. In golf, Bill's problem is rather common, as it is normal practice for golfers to be taught the importance of their mechanics, which could implicitly or explicitly create an internal focus during performance. However, given Bill's skill level and drawing on the constrained action hypotheses, it was highlighted the importance of an external focus and the positive impact it could have on his performance. Prior to the assessment, the consultant observed Bill in a tournament round alongside examining his performance statistics. This was used so the consultant and client could reinforce any point brought up in the assessment stage. Once complete, self-report data regarding Bill's focus habits came from himself in the form of a performance profile alongside semi-structured interviews with Bill, his swing coach and his caddy. Instructional phrases from the consultant alongside self-talk statements such as ball flight or landing area were used to encourage an external focus. These were practiced during mental rehearsal at home whilst incorporated into the pre-shot routine. Through the use of the self-report Likert scale, Bill and the consultant felt the focus was successfully adhered to in a practice setting. To further solidify Bill's change in focus, his mental skills were tested in a competitive situation. The consultant proposed that a low to mid-level tournament which Bill perceived as moderately stressful was a sufficient test for examining the alteration in focus. To test and reflect upon the use of the external focus, a breakdown of each shot was measured using a process scorecard. After this was recorded, the consultant dissected the round through a semi-structured interview. This helped communicate to Bill how he was progressing. It should be noted that this took place 12 to 24 hours after the round to reduce a performance reaction bias. The intervention was evaluated using 1. Analysis of an interview that explored his perceptions of the intervention programme, and 2. A sports psychology consultant evaluation form. In spite of the potential issues with golf and the reliance on teaching this physical skill through an internal perspective, the intervention was guided by theory and empirical research, which in turn was effective in helping Bill's performance and subsequently keeping his membership on tour.